Hello, this is Dr. Jamil Ahmed. I'm going to talk about winter. It is already here, and you know that we already had a few days of snow. With that, we come across some medical problems, and we all know that we are having some cough, runny nose, sneezing, and low-grade temperature. It happens almost every year, like a clockwork. Before Corona time, people would think that this is just a simple cold. You will take a Tylenol or a acetaminophen and some cough syrup, and that's it. You know, it'll get better, and don't worry about it. It usually gets better in 3-4 days. If it doesn't get better and you have a muscle ache and pain, you're worried about, is it COVID? It is possible because COVID is still ongoing, although it's not as bad as it used to be. So there is some tests that you can find over the counter, like a pilot COVID-19 test, FlowFlex COVID test. Rite Aid has some test kit, QuickView, and a Binox Now. All are good tests. Usually, you test twice. If both of them are negative, it is very, very unlikely that you are positive. So, these tests are good. It picks up the disease almost 80% of the times. And the specificity is almost 98 to 99%. So if you are negative, it is very likely that you are negative. So what else that can be? It is not COVID. So other thing that can happen, that commonly happens in the winter, is influenza. And we see that a lot of older people get it. Then is RSV, respiratory syncytial virus. We think that this is a disease of the child, but it's not. It can happen to anybody, even older people. So it can be tested. Then it's a common cold, which is most of the time, is almost 50% of the times, it is rhinovirus. There's almost 50 or 200 different kind of rhinovirus. So one bad thing about this rhinovirus is it can trigger asthma and a cough for people with asthma. So you may question why we get common cold in a winter. It is all about immunity. That people stays indoor and without sun during this season. And we know that there is a direct relation between sunlight and immunity and the disease. The cold air that gets into our nose, we know when you are young, our parents would tell to bundle up and cover your nose. There is a reason for it. Because when cold air hits your nostril, it decreases your immunity and it doesn't fight virus that well. So there is some truth to that. Another thing is that low humidity. And in a winter there is a low humidity that also creates some problem with the immunity in our nostril and the disease. And we all know about sunlight and vitamin D deficiency. So we should be careful, and if you can, expose yourself to the sunlight, and be careful whether you can take something, vitamin D or some supplement. So what is influenza? It is like other viruses that cause upper respiratory infection. There is two types of influenza virus. There is type 1 and type B. After you're exposed to influenza virus, it takes 3-4 days before you have the symptoms. And we all know about the symptoms. The cough, fever can be around 100 to 104 or between 37.8 to 40.0 centigrade. So it's warm. And you get a muscle ache, headache. Some older people can even get confused. It usually gets better without doing anything. You may have taken some Tylenol and got better. But in older people, you have to be careful that because they can get pneumonia from it. If there is a congestive heart failure, you can be in trouble because of it increases the work of the heart and you can get into heart attack, heart failure, and sometimes it can cause inflammation of the heart muscle. It is also common in COPD or chronic lung, we tell, smokers, and type 2 diabetes mellitus. These people have to be very careful not to get influenza. There's a bad thing can happen with influenza. Doesn't happen that often. We call Guillain-Barré syndrome. And it can happen within 90 days after you have a flu. And it causes inflammation of the brain and the weakness of the extremities. And some people can have a seizure. So how do we test? We can do test for the flu, and it is an antigen test. You can do it quickly. It is very highly specific. So if you are negative, you are most likely negative. Better test, which takes longer time, is to call PCR test. It's most sensitive, and it can differentiate between type A and type B. There is another test called rapid molecular test. Also can detect A and B, but not the subtype of type A, like H, and we heard about this H1N1, that type of things. If you test positive for influenza, is it better to treat or not to treat? Because it's going to get better, most likely. But if you have COPD, diabetes, asthma, sickle cell is a blood disorder, chronic renal failure, you're on chemotherapy or on chronic steroid or obesity, that is, if your BMI is over 40, probably should get treated. There is a medicine called Tamiflu. We'd give that for 7 days. You start as soon as you get diagnosed. Next thing we can talk about is RSV, or respiratory syncytial virus. It can cause pneumonia, and it is a dreaded disease in a child. But it also can happen to older people. The mortality rate over age 50 and who are admitted in the hospital for the infection, the rate is 6 to 8%. Pretty impressive. So if you have symptoms and not getting better, probably should be checked. There are some risk factors that makes you more inclined to get the disease. It's like a issue with the immunity, congestive heart failure, COPD, and persistent asthma. If you do a PCR test for RSV, which is very sensitive, and if you think that you need to go to the hospital because of shortness of breath, you should. To end this, I can tell you that most of the cold, which are due to adenovirus, are going to get better. You don't have to do anything. You take some Tylenol, drink some water, hydrate yourself, and it will get better. Recently, FDA has approved a test kit called Pixel, Pixel. This tests all three things like RSV, influenza, and COVID-19 infection, because sometimes it is difficult to isolate what is the cause for your disease at that moment. Since it is a PCR-based test, so it takes time and usually very accurate. It also detects influenza A and B. Basic idea is that you have to be safe. To do that, you have to continue your basic precautions like wearing mask, washing hand. If you know that you are feeling sick, don't go anywhere and spread the disease. Or if somebody is sick, don't go and see them. Especially somebody elderly, they cannot afford to be sick and can be deadly. So it is a time for a triple epidemic, that's what they say nowadays. And so be careful. Thank you very much.